If you're over 60, this one small habit could silently harm your heart. As a cardiologist with over 20 years of experience, I've witnessed countless older adults face sudden, life-altering heart issues, chest pain, irregular heartbeats, or even heart attacks, without any obvious warning signs. These aren't always tied to smoking, poor diet, or lack of exercise. Instead, one surprisingly common culprit is something many seniors consider harmless: over-the-counter pain relievers. Yes, medications like ibuprofen, aspirin, naproxen, acetaminophen, and diclofenac, taken daily by millions to manage aches, pains, or inflammation, can quietly increase your risk of heart attack, heart failure, or blood pressure spikes, especially during the vulnerable early morning hours when your cardiovascular system is under stress. Today, I want to guide you through 5 widely used pain relievers that could be putting your heart at risk, particularly if you're over 60. If you've ever reached for these medications to ease joint pain, headaches, or arthritis, this information could be a lifesaver. Before we dive in, I'd love to hear from you. Have you ever wondered if your pain relievers might be doing more harm than good? Type 1 in the comments if you're curious to learn more, or 0 if this is new to you. If heart health matters to you or someone you love, like this post and follow Senior Healthy Life for science-backed tips tailored for older adults. Let's start with the most surprising one: ibuprofen. Ibuprofen, the hidden heart risk. Ibuprofen is a household staple, found in nearly every medicine cabinet. It's the go-to for headaches, muscle aches, arthritis, or even a stubborn backache. Marketed under names like Advil or Motrin, it's a non-steroidal anti-inflammatory drug, NSAID, that reduces pain and inflammation. But here's what most seniors are never told: taking ibuprofen regularly, especially in high doses or at night, can silently increase your risk of a heart attack or heart failure. Let me share the story of Mr. Thomas Reed, a 68-year-old retired mechanic from Texas. Thomas was active, loved tending his vegetable garden, and took pride in staying fit. For years, he managed his knee pain from old sports injuries with ibuprofen, 400 milligrams every evening, sometimes more on tough days. He thought he was doing the right thing, keeping pain at bay to stay active. But one night, he woke up gasping, with a crushing pain in his chest. His wife called 911, and by the time he reached the ER, tests confirmed a heart attack. His blood pressure was dangerously high, and his heart was struggling. The surprising culprit? Ibuprofen. Here's why this happens. Ibuprofen works by blocking enzymes that produce prostaglandins, chemicals that cause inflammation but also help regulate blood flow and protect your kidneys. When you take ibuprofen regularly, especially in doses above 200 milligrams, it can cause your body to retain sodium and water, increasing blood pressure. In older adults, whose blood vessels are less flexible, this added pressure strains the heart. Over time, it can lead to heart failure or trigger a blood clot that causes a heart attack. Studies, like one published in The Lancet in 2017, show that doses as low as 600 milligrams daily can increase heart attack risk by up to 30% in seniors, particularly those with existing heart conditions or hypertension. Thomas's case wasn't unique. Many seniors take ibuprofen without realizing how it interacts with their heart or other medications, like blood pressure pills. The risk is highest at night, when your body naturally dips in blood pressure, and a sudden spike from fluid retention can stress your heart. My advice? If you're using ibuprofen, stick to the lowest effective dose, ideally 200 milligrams per dose, no more than 800 milligrams daily, and take it in the morning. Always check with your doctor, especially if you're on heart or kidney medications. Type I in the comments if you're taking ibuprofen regularly. Let's open the conversation. Aspirin, not always a heart protector. Aspirin is often hailed as a heart hero because low doses, 81 milligrams or baby aspirin, can prevent blood clots in people at risk for heart disease. Many seniors take it daily, believing it's a safe way to protect their heart. But taking over-the-counter aspirin, often 325 milligrams or more, without medical guidance can lead to serious heart risks, including arrhythmias or internal bleeding. Consider Mrs. Clara Evans, a 77-year-old retired nurse from Ohio. Clara was meticulous about her health, eating well and walking daily. After reading online that aspirin could prevent heart attacks, she started taking a 325 milligrams tablet every morning, on top of her prescribed blood thinner for atrial fibrillation. She thought she was being proactive. But one morning, she felt dizzy, weak, and short of breath. Her family rushed her to the hospital, where tests revealed internal bleeding in her stomach and an irregular heartbeat exacerbated by the combination of aspirin and her blood thinner. Aspirin thins the blood by inhibiting platelet activity, which can be helpful in small doctor-prescribed doses. But in higher doses, or when combined with other blood thinners like warfarin or Plavix, it can make your blood too thin, increasing the risk of bleeding in the stomach or even the brain. For seniors, whose blood vessels are more fragile, this can also trigger heart rhythm issues, like atrial fibrillation, which raises stroke risk. A 2019 study in JAMA found that daily high-dose aspirin in healthy older adults increased bleeding risk without significantly reducing heart attack risk. Clara's story is a reminder to never start aspirin without a doctor's advice. If you're over 60, the safe dose is typically 81 milligrams daily, and only if you have a specific heart condition. Check your labels, and if you're on other heart medications, talk to your doctor immediately. Type A in the comments if you take aspirin regularly. Naproxen, a double-edged sword. Naproxen, sold as Aleve, is another NSAID popular among seniors for arthritis or chronic pain. It's longer-acting than ibuprofen, so many assume it's gentler. But naproxen can pose similar, if not greater, risks to your heart. Mr. Henry Lopez, a 72-year-old former carpenter from California, learned this the hard way. Henry took naproxen, 500 milligrams, twice daily for chronic back pain. Over months, he noticed swelling in his legs, shortness of breath, and fatigue. His heart was struggling with fluid retention, a side effect of naproxen that led to heart failure. Like ibuprofen, naproxen causes sodium and water retention, raising blood pressure and straining the heart. It also inhibits protective prostaglandins, which can stress your kidneys, further complicating heart health. A 2016 study in the BMJ found that naproxen increases heart failure risk by up to 20% in older adults, especially at doses above 250 milligrams per dose. For seniors with high blood pressure, diabetes, or kidney issues, the risk is even higher. Henry's recovery required stopping naproxen, adjusting his heart medications, and monitoring his kidney function. If you use naproxen, keep doses low, ideally 250 milligrams per dose, no more than 500 milligrams daily, and consult your doctor. Take it in the morning to minimize nighttime blood pressure spikes. Type N in the comments if you've used naproxen recently. Acetaminophen, not as innocent as it seems. Acetaminophen, known as Tylenol, is often considered the safest pain reliever, free of the bleeding risks associated with NSAIDs. But for seniors, high doses can indirectly harm your heart by stressing your liver and disrupting electrolyte balance. Mrs. Lillian Carter, an 80-year-old retired teacher from Georgia, took acetaminophen, 1,000 milligrams, several times a day for chronic arthritis pain. Over time, she felt increasingly fatigued, with occasional heart palpitations. Tests showed liver stress, which had thrown off her potassium and sodium levels, triggering irregular heartbeats. Acetaminophen, when overused, can damage the liver, which plays a key role in regulating electrolytes that control heart rhythm. In seniors, whose liver function may already be slower, doses above 2,000 milligrams daily can also raise blood pressure, adding strain to the heart. A 2022 study in Circulation linked regular high-dose acetaminophen use to a modest increase in heart rhythm issues in older adults. Lillian's case improved after cutting back to 500 milligrams per dose, no more than 1,500 milligrams daily, and avoiding alcohol, which worsens liver stress. If you rely on acetaminophen, check your total daily dose, including any in combination medications like cold remedies. Type T in the comments if you use acetaminophen regularly. Diclofenac, a potent but risky choice. Diclofenac, available as Voltaren pills or gel, is a powerful NSAID often prescribed for arthritis or severe pain. But it carries some of the highest heart risks among pain relievers. Monsieur George Patel, a 75-year-old retired banker from Florida, used diclofenac gel and pills daily for joint pain. After months, he suffered a heart attack. Tests showed elevated blood pressure and cholesterol levels, worsened by diclofenac's effects on his cardiovascular system. Diclofenac increases blood pressure and cholesterol levels more than other NSAIDs, raising heart attack risk by up to 40% in seniors, according to a 2018 study in the BMJ. It's particularly risky for those with diabetes, high cholesterol, or existing heart disease. George's recovery involved stopping diclofenac, starting a new heart medication, and lifestyle changes. If you use diclofenac, use the lowest dose possible and consult your doctor, especially if you have heart risk factors. Type D in the comments if you've used diclofenac. A safer path. Protect your heart with food and movement. By now, you might be wondering, if pain relievers are risky, what should I do instead? The answer lies in your kitchen and daily routine, not your medicine cabinet. Let me tell you about Mrs. Ellen Brooks, a 71-year-old retired librarian from Arizona. Ellen came to me with a bag full of pain relievers, ibuprofen, aspirin, and acetaminophen, for her arthritis and headaches. She also had high blood pressure and fatigue. Her reliance on pills was masking symptoms and raising her heart risk. We took a different approach. We replaced her pills with a heart-healthy routine. Her breakfast became oatmeal topped with blueberries, rich in antioxidants, a handful of almonds, healthy fats and magnesium, and a glass of water to stay hydrated. She added a 15-minute morning walk and gentle yoga stretches to reduce inflammation naturally. Within weeks, her joint pain eased, her energy returned, and her blood pressure stabilized. She told me, "I feel like I've gotten my life back." Here's why this works. Your heart thrives on balance, not high-dose medications. Foods like fatty fish, salmon, sardines, provide omega-3s to reduce inflammation and protect heart cells. Leafy greens, spinach, kale, offer magnesium and folate to support blood vessels. Berries and nuts provide antioxidants and healthy fats to stabilize blood pressure and cholesterol. Whole grains like oats or quinoa deliver steady energy without spiking blood sugar, which stresses the heart. Gentle movement, walking, stretching, or tai chi, reduces inflammation and improves circulation without the risks of pills. Try this simple plan. A breakfast, oatmeal with berries, a boiled egg, and a handful of walnuts. A lunch, grilled salmon with spinach salad and olive oil dressing. A dinner, quinoa with roasted vegetables and a small chicken breast. Movement, 15 to 20 minutes of walking or stretching daily. Hydration, drink water throughout the day to support your heart and kidneys. This isn't about perfection, it's about consistency. Ellen's dizziness faded, her blood pressure dropped, and her energy soared. She no longer needed pain pills daily, relying only on low-dose acetaminophen for occasional flare-ups, under her doctor's guidance. Final wake-up call: knowledge is your best medicine. At 60, 70, or 80, your body doesn't process medications the way it did decades ago. Even safe pain relievers like ibuprofen, aspirin, naproxen, acetaminophen, or diclofenac can quietly harm your heart if you're not careful. The key is awareness. Read labels, know your doses, and talk to your doctor before starting or continuing any medication, especially if you're on heart or blood pressure drugs. Your heart doesn't need megadoses, it needs balance. Swap pills for whole foods and gentle movement whenever possible. Listen to your body's whispers, fatigue, swelling, or palpitations, before they become screams. What's one change you'll make starting tomorrow? Share it in the comments. If this information resonated with you, like this post to help others find it, and follow Senior Healthy Life.